Hello and welcome to Random Chats. Today we are going to be talking about, of course, the coronavirus because that is what everybody is talking about. That is what is happening today. So if you'd like to hear what I have to say and what I've read up on what other people are saying about the coronavirus, what things look like in Saskatoon in the grocery stores, well, at least in Walmart, and other days I'll check out other stores. Stay tuned. On December 31st of last year, China reported to the WHO, or the World Health Organization, of several cases of an unusual pneumonia in Wuhan, a port city of 11 million people in the central Hubei province. The virus was unknown at the time. Several of those that had been infected had been working at the city's Huanan seafood wholesale market, which was shut down on January 1st. As health experts worked to identify the virus, amid growing alarm, the number of infections exceeded 40. January 5th, Chinese officials ruled out the possibility that this was a recurrence of the severe acute respiratory syndrome SARS virus, an illness that originated in China and killed more than 770 people worldwide in 2002 and 2003. On January 7th, officials announced that they had identified a new virus, according to the WHO. The novel virus was named 2019 nCoV and was identified as belonging to the coronavirus family, which includes SARS and the common cold. I'm going to be reading symptoms of the coronavirus so we can distinguish between the influenza, the cold, and the coronavirus. I'm going to be showing you videos, footage of people overstocking on things and leaving other people with nothing, which I don't think is right either, as we all need to have things. In Walmart today, I was videoing the aisles and there was no bread left in Walmart of any type. There was not a lot of meat left. There was ham and ribs, maybe a little bit of other things, but not very much of anything. Toilet paper, not one roll, not one package of toilet paper. And there are people that came to buy toilet paper because they honestly needed some. They weren't trying to stockpile, and they couldn't find any. I talked to another gentleman there who had said he had been to Costco and all of their bread supplies had been sold out. So what people are doing, I have no idea. But let's get into this now. We're going to take a look at some symptoms here. I think a lot of people need to understand, including myself, the differences between the COVID-19, the cold, and the influenza, coronavirus, and the flu. Now, COVID-19 is caused by the virus now called severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Then there's influenza. Influenza is caused by any several different types of strains of influenza viruses. The transmission of either of these, the transmission of COVID-19 or influenza, they can both spread from people through droplets in the air from coughing, sneezing, or talking. One possible difference, COVID-19 might be spread through the airborne route. So they're not 100% sure, but they're thinking that is a possible way to. It's saying here, is it the flu, a cold, or the new coronavirus? Patients and doctors alike are parsing signs of illness to figure out who needs what tests or care and how worried they should be. You have 3 different major viruses floating around at the same time, causing somewhat similar symptoms, which makes it very difficult. But different levels of concern, said Dr. Gary Leroy, president of the American Academy of Family Physicians. So, what's the biggest danger? And why are we responding to them so differently? A familiar foe, it says. COVID-19, the disease caused by the new coronavirus, is a flu-like illness that has killed a small fraction of the number of people that the flu kills every year. Through the first 4 months of the outbreak, coronavirus has killed about 4,300 people, and I believe that number has risen since this was written. Okay, so what do I have? Flu, cold, or coronavirus? Now, these things often share very similar symptoms, but the differences are intense. So how are we going to distinguish between them? Doctors can test for the flu, get results within a day, but the coronavirus testing is still limited by availability in the United States. Colds are often suspected because adults get about 2 on average each year, said Leroy, a family medicine doctor and associate dean at Wright State University in Dayton, Ohio. Now I'm looking down because I am reading off of my computer the information online that is here and available for us. The common cold just starts out with a sore or scratchy throat, cough, runny nose, stuffy nose, and any fever is usually mild, he said. Flu symptoms are more intense and usually come on suddenly, the Yale New Haven Health Systems advises. They can include a high fever, over 100.5 degrees, extreme exhaustion, muscle or body aches, a dry cough, and chills. It really hits you like a bus, and people may start a day well, but feel terrible by afternoon, Leroy said. Flu symptoms can include a runny or stuffy nose, headaches, and possibly vomiting or diarrhea, though the latter two are more common in children than adults. The U.S. Centers for Disease Control and Prevention says. Symptoms of COVID-19 may appear more slowly. They usually include fever, a dry cough, and noticeable shortness of breath, according to the World Health Organization, or the WHO. A minority of cases develop pneumonia, and the disease is especially worrisome for the elderly and those with other medical problems such as a high blood pressure, obesity, diabetes, or heart conditions. Precaution: what do you do if you are sick? They say to not go straight to the doctor when you're sick, or if you're sick. First call ahead and see if you actually need to go to the doctor, because if you are contagious, what's the point of making other people sick? So call ahead, see if you need to go, and if you do, where you should go. Fever, cough, and noticeable shortness of breath. If you have those 3 components, especially if it's associated with some recent travel or someone you know who has been exposed to COVID-19, those things should prompt you to call for medical attention, Leroy said. Now, a page from the Canada government. It says, in Canada, our health system is prepared for this situation. Since the onset, the Public Health Agency of Canada, along with public health authorities at all levels of government across the country, have been working together to ensure that our preparedness and response measures are appropriate and adaptable, based on the latest science and the evolving situation. At this time, PHAC has assessed the public health risk associated with COVID-19 as low for the general population in Canada, but this could rapidly change. There is an increased risk of more severe outcomes for Canadians. The higher the risk are for people that are over 65, that have compromised immune systems, or have underlying medical conditions. So be careful, everybody. Don't just think about yourselves, think about other people. Why is it good that these events are being shut down and things are being shut down as needed? Because we need to make sure that those who have lower probability of making it if they get this don't end up getting it. We need to stop this for the sake of others. There is a low risk of it spreading. And I think what is helping that, and is going to help that, is that everybody's taking precautions. You still see quite a few people out in the streets and the grocery stores trying to prepare, I'm assuming, to make sure that they have enough food and toiletries to last in case there is a lockdown, or they are locked down, or get sick or can't get out of their home. It goes on to say that our public health efforts will continue to focus on containment to delay the onset of community spread by rapidly identifying cases, meticulously finding close contacts, and using tried and true public health measures such as isolation and social distancing, which is happening in Saskatchewan and different parts of Canada. Events are being closed down. In some parts, people are wearing masks. It just depends where you are, what's going on. But everybody's trying to do something. And it continues to say, in the event of community transmission, these actions will continue as long as feasible to interrupt chains of transmission in the community and to delay and reduce an outbreak where possible. So if everybody's cooperative and does what they're asked to do, there's a greater possibility that this will stop and the spread will stop. In order to mitigate the impacts of COVID-19, everyone has a role to play. It takes more than governments and action from the health sector to protect the health and safety of Canadians, and that's everywhere. Each of us can help our country be prepared in the event of an emergency by understanding how coronavirus spreads and how to prevent illness. So everybody, we need to do our part. We can't expect things to go away without doing our part and without making a plan. Part of making a plan, it says to stock up on essentials but avoid panic shopping or panic buying, which I believe people are doing, which you have no need to do. Make sure that you have enough food, and it says in case you get sick. It does not say in case you have to stay indoors. I'll go on and I'm going to read this just to make it a little easier. At this time, it makes sense to fill your cupboards with non-perishable food items so that you do not need to go shopping if you become sick. So it doesn't say if you need to stay enclosed. It says just in case you become sick. It is easier on the supply chain if people gradually build up their household stores instead of making large-scale purchases all at once. Now, when I show you the videos, you will see what they mean by this. People are doing large-scale shopping, and it's hurting others. To do this, you can add a few extra items to your grocery cart every time you shop. Good options are easy to prepare foods like dried pasta and sauce, prepared canned soups, canned vegetables and beans. And those are the items that I'm actually seeing missing on the shelves, as well as bread. And of course, it says to get extra pet food if you have pets, toilet paper, facial tissue, feminine hygiene products, diapers if you have children who use them. The reason for stocking up on these items is not necessarily because you will need to self-isolate. Having these supplies on hand will ensure you do not need to leave your home at the peak of the outbreak or if you become ill. So it's just to be prepared. It doesn't mean everybody needs to live in fear, but be prepared. So stay tuned for tomorrow. I will have another video out, get on some updates on coronavirus from other places, from what's going on in Saskatchewan, and I believe we can continue living as we need to live, doing what we are able to do, but we need to work together, and we all need to do our parts, washing our hands, washing our homes, cleaning our washrooms, washing the tables and countertops. Anywhere that you're going to sneeze into a Kleenex or your sleeve. Kleenexes you can dispose of, so if you have one at hand and ready, it's probably the best option, and then wash your hands after. Water and soap is the best option. If you are not near water and soap, then yes, you're going to have to use hand sanitizer. But thank you guys for joining me today. I hope you enjoyed this, and I hope it was informative for you. Stay tuned tomorrow. I will be bringing more news for you and more updates on the coronavirus in Canada and possibly other parts of the world as well. Take care. Bye-bye.